Okay, last question today is from Carter. Carter says, lots of people have mutual funds, and in those mutual funds, lots of people have shares of health insurance companies. If universal health care is passed, whether it's Medicare for All or some other system, do all those people owning health insurance shares get crushed? Well, a couple things. Number one, there are many more players in the health insurance market that are probably in most people's mutual funds than just for-profit health insurance companies. There are nonprofit health insurance companies. There are the hospital ownership chains. There are the pharmaceutical companies. There are many other players, I guess, is what I'm saying. So that for-profit insurance companies will definitely be negatively affected if something like Medicare for All were to pass. But that's not all that you might be exposed to if you are a mutual fund holder. But it is a fair question, which is if you're just an average middle-of-the-road person with a little bit of money in mutual funds, and you would benefit from the existence of Medicare for All itself, if a bunch of these companies that depend on healthcare being for-profit all of a sudden go out of business or have to significantly downsize and their shares, the value of their shares plunge, that is going to plunge the retirement accounts of some of those people. Logically, there's something to that. But what you have to remember is that the overwhelming majority of shares of stock are already held by the very, very rich. And even among those who are not of the richest tier of the economy, but have shares of mutual funds or stocks, they have a disproportionately small amount. So there's really no way to say to Carter, no, you're wrong. It would not have any impact on those businesses. But I think it's also important not to overstate the importance of that and to not understate the importance of eliminating the possibility of a medical bankruptcy, which is a reality right now under our current system.
So under Bernie Sanders' plan, it would be like a 4-year transition process into Medicare for All. I mean, I guess the people working in the for-profit health insurance companies would have other roles they can go into because care would be contracted out, so there would still be some administrative roles they could fill in. When you talk about the stock market, I mean, of course, there would be uncertainty, even though there's a 4-year transition period. When it's initially passed or just even debated, of course, those stocks are going to crash, right? I mean, you can't say for sure.
Well,
but
I actually think that you're getting at the real stock market risk that exists, which isn't individual mutual funds will have a decrease in value as a result of the components of those mutual funds that are impacted by single-payer healthcare losing money.
Yes.
I think that there will be such a shock to the system if there were to be a transition to Medicare for All, that there would be a general market crash, at least initially, although ultimately Medicare for All could provide significant demand-side stimulus to people by reducing the amount that families are spending on healthcare. Your average lower middle or middle-class family is going to take the money that they're saving and they're going to reinvest it into their local economy. It could actually be really stimulative, but in the short run, it's going to be bad.
Certainly something to brace for, too, if Democrats are going to be pushing for this in the next few years, because if the stock market is facing negative repercussions from it, I mean, that's going to play into the argument of Republicans, isn't it?
Yes, it is. And Bill Scher did mention that earlier this week. Bill Scher said that when you talk about the total shakeup of such a major industry, aside from the merits of Medicare for All, you have to consider the strength with which many of these industries would fight against it. And that's not... I'm in favor of Medicare for All, to be super clear, but Bill Scher was not wrong in saying that you would have insurance companies fighting for their lives, and that would be sort of part of what would have to be managed. But very good question, Carter. I mean, this is the type of thing people should be thinking about, right? Well, what are other ways in which it might maybe negatively affect the average consumer of healthcare, middle-class person in the United States? All right, that's it for today. We've got a great bonus show for you. Stay tuned, davidpakman.com/membership if you don't yet have access to the bonus show. And of course, patreon.com/davidpakmanshow, which also now at the $5 level gives you instant access to every single one of our bonus shows.